things available, including hopefully with subtitles.
Okay. Well, I'm very happy and thank you, Ken, to let me think together about rickettsioses and other obligated intracellular organisms. So when you have next, when you have a tick-borne disease, I don't say a tick bite fever, a tick-borne disease, you are exposed to all the specialists. Those germs can come into your lungs, your intestine, give you heart problems, motor neuron diseases, or any neurological diseases, psychiatric diseases, nephrology, dermatitis, sinusitis, rheumatoid arthritis, or anything like this. Ophthalmic, you can also have genetic deformation, muscle atrophy, prostatitis, gynec disease, and pancreatitis. Next, I'll tell you why. Do not take the end product, meaning the symptoms, as a disease. There's only one way to do medicine. Find the cause of the pathology, not where the problem is situated today, because it will move tomorrow. Next. A medical diagnosis is generally issued from the patient's symptoms. So you put the symptoms together and you make from this a disease. And you call it fibromyalgia, chronic fatigue syndrome, ME, yappy flu, lupus, rheumatoid arthritis, AS, myasthenia, which is very much of a fashion now, IBS, autism, etc. They are generally a secondary condition of a complex primary infection. Modern medicine treats them according to an appropriated medical dictionary, not worrying about the possible origin. That medical dictionary will never solve the condition because the cause is not looked for, and furthermore allows the attackers to move into the human body under different names, according to their location. Next.
1 second.
Because a germ does not give its name to the disease, but the name of its position in the body. So mycoplasma can give you anything. Bilharzia can give you anything. It depends where it is situated in the body. And there is no borders. It moves from one side to the other, according to its nature, to its activity, to its laziness, to going dormant, to active. Next. Example. This is a true story. I had a patient about 30 years ago that entered medicine with an acute appendicitis, which is often the case because, as we all know, the appendix function in the body is to swallow the toxins emitted by germs in our body. So the appendix is overworked and gets infected and very often needs to be removed. That patient, after the appendicectomy, developed a myelofibrosis. She refuses to take the treatment of chemotherapy and came to me. I find some germs, I treat them. It took me 2 years to reverse the myelofibrosis. Then she had a heart attack that was treated with stent, followed by a rheumatoid arthritis, treated with antibiotic. But always the treatment was a bit too short because she really didn't like to take medicine. The rheumatoid arthritis became unclearly a lupus. Then she developed a colon cancer, redirected to the psychiatrist for depression. She had a few epileptic attacks, treated with antibiotic, and now, recently, she developed a glaucoma. This is very common to me. Glaucoma are very much part of rickettsial infection. Chlamydia is the biggest cause of blindness in Africa. So don't we find that there is a need of stitching or connecting. It's not so rare case. We must connect. There is a reason behind this. It's not by accident that the same patient develop all those conditions. Next one. The reservoir of the germs that we are talking today are found in rats or in other rodents, in bats, in uncooked animal products, so unpasteurized milk, unpasteurized cheese, uncooked meat, and also in any reptile, gecko, crocodile, and so on. Next. The vectors that they have to distribute their germs are tick, flea, lice. Next. You don't need to be bitten because the droppings of the rats and the rodents and the bats are containing those germs and will with time become dust. So that the dust will touch any patient, going through the skin, the eyes, the nose, the throat. Next. Lyme is actually not a disease. Lyme is a village in Connecticut. Lyme disease is a dangerous appellation, blinding the presence of other obligated intracellular organisms, leading, I've seen it often, to seronegative Lyme disease. This doesn't look scientific to me. Rather use the term borreliosis for this bacteria, found by Amédée Borel in the 1920s, I think. Next. Brief history about borreliosis. In 1702, Drury found the borreliosis in Central Africa. In the 1900s, it was found in Spain. In 1920, Charlie Cole was working in Tunisia and came across the same borreliosis. In 1933, in Congo, Shedd did the same discovery. In 1944, in Cape Town, it was the turn of Parasitic to identify the borreliosis. In 1950, in Kenya, H did the same journey. Helen Sparrow, she was a student of Charles Nicholl, found it in Ethiopia in 1950. And then came Burgdorfer in Connecticut. It was a village of the village Lyme. There was an epidemic of rheumatoid arthritis in a school in 1975. There was born the name Lyme disease. Forgetting about borreliosis, which is actually a very sad mistake. Next. Also to insist that that germ is not a new germ, the Otzi mummy found in the Alps in 1991 was full of arteriosclerosis with DNA Borrelia burgdorferi in her brain, and she was over 5,300 years old. Next. In our practice, we look systematically for all those germs. So if I show you, coming from the up left, this is written in small Coxiella burneti. Coxiel and Burnett found this germ in 1920 about. This is Q fever, called Q because query, that fever that was coming all the time was called query fever. Coxiel and Burnett found that germ, had a Nobel Prize for it, and then, as there was no antibiotic those days, treat themselves with methylene glue and both die of it. Left of this, you find the worm. Worms are also distributed by ticks, fleas, and are in the air. Under this, we find the Rickettsia connery, found by Dr. Connor. Above this, the yellow little thing is a Chlamydia pneumoniae. Above this again, we've got the mycoplasma, where you find a red cell floating in the middle of green little bodies that are mycoplasma. Under this, we find the phase nearly human of Giardia. Under that, the horrible little Helicobacter pylori that can come from the stomach into the brain. About all my patients having MS, Parkinson, motor neuron disease present with Helicobacter pylori. Now, if we stay down there, we find the toxoplasmosis. Toxoplasmosis, this is the Toxoplasmosis gondii that goes into cysts. Those cysts are not really dangerous if they don't burst. When people fall, like after ski and things like that, Toxoplasmosis gondii go all over, and it's a very big problem. Above this, we've got that little blue and yellow body, that's brucellosis. Brucellosis is well known as a disease, a farm disease. People in contact with meat, but the hunters are also in contact with meat, and only people that cook raw meat will touch it. So brucellosis in those days is very common. It affects a lot the joints, give big joints, pain and diseases. Above this, we've got the Lyme, the borreliosis. On the right of the borreliosis, we have the Bartonella ensele, also called cat scratch disease. Next to it, we have those red blood cells with a green little thing called Bartonella quintana. Bartonella quintana was the germ that killed Napoleon's army more than the bullets. Just a bit towards down this one, we've got the big worm bilharzia, very dangerous germ. Below that, we've got the chlamydia trachomatis. That is thought to be a sexually transmitted disease, but in my patients, there's a lot of young people, 6 to 12 years old, that are positive for this and modern negative. So I doubt about this origin. Okay, next. Our observation that's also very disturbing for a lot of people is that we have 2 antibodies that are protecting us from germs. The IgM is a big molecule. Its size is big. It can go into the tissue. So it stays into the circulation. People think normally that IgM is a new infection. No, it's not a new infection. Each one is following the trajectory of the pathogen, as we regularly see in our patient serology. They will produce alternatively IgG and IgM. IgG, as you see on that slide, is a very small tiny molecule that can enter the endothelial cell and also the tissue. So it's not an old infection. It means that the germ is moving. Very often, when you find IgG to start the first visit, and 6 months later of antibiotic, the same germs go into IgM. So it's not like, established like this IgM new, IgG old. No. In my practice, on thousands and thousands of patients, I say it's not the case. Another very important thing is a germ never presents alone. That's why if you look for borreliosis, you're wrong, because borreliosis is never alone. Next. We evaluated to signal all the carriers from the sequence. We, of course, consider the symptoms of the patient, but we look for the full blood count and the ESR that shows the activity of the germs. We also investigate the iron study, which we find often a saturation of iron low. function, because those germs are very toxic for liver. Kidney too. The cholesterol, which is about omnipresent with mycoplasma. Cholesterol is needed for the germs to grow. The sugar varies according to the activity of the germ. The thyroid is well appreciated by those germs because it is rich in iodine. The CRP, the rheumatic factor, the antinuclear factor, the creatinine kinase, and the calcium are autoimmune response from the body to the attackers. It is not a condition, it is not a disease as such, as by treating the germs, those factors disappear. So it's not a condition, autoimmune disease, it's an autoimmune response. The protein electrophoresis measure the condition of your immune system. Does it work too high, too low, or is it normal? The IgE is allergens that people produce against the germs. It becomes after a while aspecific, and it's against food, against dust, against cats and dogs, and very often doctors only look at food, cats and dogs and things like that, and don't realize that there is a switch that's put on because of the germs. Next. Oh, this is the wrong version. But it doesn't matter. I have another I correct that version, but it doesn't matter. I will explain to you that now. Here seen at front of the Pasteur Institute of Tunis, there are two stelae erected in 1936, as my father, Professor Cécile Jadin, was working there. I went there a few years ago, and I was wondering why at front of the Pasteur Institute there are the same germs that I deal with. I asked Professor Ali Boiteau, that was working there those years, why are you still doing that? He said, of course, what else are you doing in medicine? So are we dealing with a unit of pioneer in medicine? Why is it only in Tunisia? You don't find it anywhere else in the world. So there I say typhus, the neglected killer. The typhus was also found in, I didn't put it there, but in the Middle Age, when Thucydides was having his war, Socrates, there's a very good book called Madame Socrates by Gérald Massadier. If you can read it, it's very interesting, saying that Socrates lost Athens and the Peloponnesian War in Macedonia too because of fleas. They were infested by fleas. Same thing in the Crimean War, the typhus killed people. We see there a statue that was erected after the massive Irish migration in Canada in the 1847. The Irish people were having typhus and were in quarantine before they could come into Canada for years. Next, please. In the Nazi concentration camp, the typhus was all over too. In Ukraine, in those days, all the doxycycline of France, Belgium, West Europe are gone to Ukraine. It's the wrong way to treat typhus, but it's the normal way they take doxycycline. The migrants via Mediterranean Sea, they're also full of typhus and bring it where they go to. Tarasevich, a Russian writer, claimed that 3 million of people died of the same typhus during the First World War, just to name a few. Next, please. Typhus means stupor in Greek. Stupor was the name used by Homer. Homer was a Greek philosopher before Christ that was saying that when the big white birds were coming from Africa in Athens, the whole population was plunged in a state of stupor. Typhus is rickettsia. There is more than a few hundred species. Q fever is included. And now we speak about the neorickettsia, which is mycoplasma and chlamydia.
Okay, may I just pop in? The word stupor, the modern equivalent is probably the word brain fog.
Exactly. I should have said that. It's brain fog. Yeah.
Okay.
Yeah. Just like brucellosis, toxoplasmosis, Helicobacter pylori, borreliosis, babesiosis, Bartonella, they are obligated intracellular organisms. Therefore, they will require a specific treatment adapted to their multiplication rhythm, which is a month, and their intracellular position. The treatment that we use consists in 7 days per month of antibiotic, as it takes the OIO 4 weeks to fill in endothelial cell when they are active, because they are rather lazy germ and they're not active all the time. So we take 2 antibiotics, a bacteriostatic to open the cell, combined with a bactericidal to kill what is inside. If you use the bacteriostatic by itself, it's like putting a red carpet for the germ. They can just walk in the blood vessel and find other endothelial cells to invade. If you use only a bactericidal, you will kill the germs that are looking for another cell. After killing the mitochondria of their cell, they need some more food and they go somewhere else. We alternate our combination to avoid mutation, to avoid destroying normal cells, and to allow normal intestinal bacteria to be restored between the things. Between the treatment, sorry. In considering the modern alimentation, antibiotics given in meat and fish to the animals, the daily intake of probiotic is recommended. We don't have, with using our pulse therapy, we don't come across a lot of guts problem. The daily intake, so we recommend the daily intake of probiotic. The treatment also includes vitamin B complex, as the antibiotic refrain their normal production. Is there a hand that wants to ask a question? No. No, the hand disappeared. The treatment, we also give proton pump inhibitor to protect the stomach from the antibiotic aggression.
I'll just quickly inject here. I checked my database for proton pump inhibitor, and it actually is interesting because it encourages the growth of both bifidobacteria and lactobacillus. So it's almost a prebiotic by itself, which was found interesting when I looked it up. I was curious, and it encourages almost all what are commonly called used probiotics.
Yes, I agree. Yes, our choice of association of antibiotics for adults. I don't think I will read that. You have it printed somewhere. We always to say something about the ciprofloxacin that have in our days a very bad name of fragilizing the tendon, even tearing them. I haven't seen that through all my practice, but I always recommend it when you take it, not to do exercise. Of course, we consider the allergy of certain patients to this and that. The dark sun is now very fashionable in America due to horrors, but it's actually a product that was invented by my father for the leprosy. It can be give you blue lips. This is a genetic fact due to the hemoglobin being changed into methemoglobin. All those antibiotics have to be taken after food, not only water, as you see often on the internet. And also, very important, without any dairy products that will diminish their absorption. Patients must avoid sugar because sugar feeds the germs. Sugar, magnesium, and glutamate are feeding the germs. I was feeding the animal in my father's lab, meaning guinea pig, rats, and chimpanzee, with sugar, magnesium, and glutamate to make the rickettsia and neorickettsia grow better. A thing that I would like to insist on is the vitamin D. The vitamin D is, as you can see there, the main product to kill rats. When you give EcoRat to rats, there is a stone that comes out. We are big rats, so it's not going to happen overnight, like for them, but it's going to happen. I've seen lots of patients with big damage on fingers that had to be amputated and things like that after taking a lot of vitamin D. I had yesterday a new patient that had already 5 operations to remove calcium plaques in the shoulder that she can't move anymore after the intake of vitamin D. Especially during the COVID, everyone said take vitamin D, which the consequences are coming now. Next, please. Patients are also given Nivaquine between antibiotherapy, not with, in case of the presence of autoimmune factors. See the copycat mechanism of the OIO. They cover themselves with the host protein as a protection against antibodies. So when your immune system comes there, it can see it. If you take Nivaquine, it peels those proteins off. It's well described in the copycat mechanism. Careful, side effects of Nivaquine is possible, but very rare. It can give you black spot in your eyesight. This is reversible, but you stop if it happens. Patients are also given Silimarin, in other words, Legalan, in case of liver toxicity. Biltricid, if needed, has to be taken a week after the antibiotic. Deworming every 6 months. No vaccine except the children's requirement, of course. No deep massage, that's especially for toxoplasmosis, and for any other one that makes cysts, because the cysts will just burst. Do not remove your teeth filling because it makes always the situation worse. Treatment controls the multiplication of the germs rather to get rid of it because relapses do exist and are frequent. But they can be controlled again and easier than the first condition. Next, please. Bilharzia. Bilharzia, I think it's very important to speak about this. People say that bilharzia is a South African or African disease. Not true. People, as you see, migrate everywhere with their germs. It's a worm that measures 5 centimeters, as big as a matchbox. Very often people that have it complain about a feeling in the thighs, feeling of things moving in the thighs. Next one. It's only present on Earth. My friend, Professor Tim Roberts, always tell me there is no bilharzia in Australia. But I see him often coming to Botswana to recruit some students for his Newcastle University. He recruited students, but they're full of bilharziosis. And it just means one or two being there, a snail passing by, taking the egg, putting it in form of circadia, and then near circadia that someone can touch, and it's in your system. Bilharzia is a very lazy worm. It lays, when it's active, 200 to 2,000 eggs a day. Its lifespan is 40 years. It rarely causes hematuria, but more often epilepsy. I was a doctor of a competition down in the KwaZulu-Natal and had so many young people with epilepsy treated with biltricid and recovered. The bilharzia kills more than 300 people per year. Per year. 300 a year. Eggs will be retained in a pocket of calcium, mimicking a tumor or a cancer. I had a few patients treated for cancer, and when we had the possibility to remove that tumor, it was like that picture on the bottom there, a pocket of eggs in a pocket of calcium full of eggs. I had a friend like that. This is a photo of a friend of mine living in Cape Town that had an entry for cancer, and eventually we took the tumor out that was in his lungs, and that tumor was full of eggs. The treatment, so it gets through the blood-brain barrier. The treatment needs at least 5 years of therapy, praziquantel, twice a year, according to the weight of the patient. Yeah. Next, please. So I always say that wash the body, wash the organs, do not remove, do not transplant. My antibiotic are the washing powder, and the patient's body is a washing machine. Next. There is a link between obligated intracellular organism, virus, fungal, and cancer. Obligated intracellular organisms open the way to virus entry, leaving fragilized tissue. The same for fungal infection. Virus and fungi are treated in between antibiotherapy if required. Being intracellular, OIO will modify the cell morphology, exercising a pressure and changing the morphology. The modified cell will be cloned as well as the original cell. Here is the birth of a cancer. Next, please. Link with cystic forms, biofilm, and modular disease. This is
Okay, I'll just.
This is a different appellation for different manifestation of the same pathology. It's amazing because when I've got recently a lot of modular disease, I treat them the same way, and the little cysts that they have under the skin, pretending it's material or textile, things like that, disappear. So I think it's the same reality with a different appellation. By the way, in cancer, often we find fungi and virus are present. Next one. So that story has no end. I wish it would start